name's Omar from the Total Foot and Ankle Clinic. I'm the podiatrist at this clinic, and so we'll be discussing or diving into heel pain. What is heel pain? Obviously, people getting discomfort around the heel area. This can happen when you first get out of bed in the morning. It can happen when you walk for a long period of time. Even the symptoms can come about after resting, and then standing back up, you'll feel a pain at the bottom of the heel. Sometimes it may only come for a day or two and disappear, or it can last a very long time. We're talking months, even up to sometimes a year before patients actually come in and have it assessed. What's happening? The bottom of the heel, there's something called the plantar fascia. The plantar fascia is a tendon that is attached to the heel. What happens to this tendon, either because the foot is rolling in, or possibly sometimes even rolling out, or in a certain position, mechanical position that the foot is placing itself in, it's causing strain, so it's causing a pull, and it's causing a strain on the tendon that exists on the bottom of the actual foot. And so where it inserts or attaches to the heel, you get inflammation and you get pain. Generally, when patients come in, we need to decide what is the cause of the actual problem. Is it that the foot is pronating, meaning rolling in too much? And when the foot rolls in, it stretches, it elongates, it causes stretching of the plantar fascia. Is it because the way they're walking, their stride is incorrect? What's going on biomechanically that's causing this actual problem? That's very important. An assessment is very, very important. So patients will undergo a biomechanical assessment, foot and ankle, which includes a foot and ankle assessment. Will include a gait assessment, which is a walking assessment that we have on the treadmill, that we're able to record and monitor and analyze the way that they step and the way that they're walking. We'll check their lower limb mechanics. We'll check, obviously the range of motion of the joints, of the ankle, of even all the way going to the hip, to try to decide or piece together and paint a picture to see what is causing this heel to become painful, and how are we going to relieve tendon or tension from this tendon or from this fascia. So don't just let your heel pain continue. Get it treated, get it assessed. Sometimes in the early phases, the treatment can be quite simple, rather than other times where it becomes a little bit more complicated. So generally, plantar fasciitis is related to a repetitive type of injury when it hits the chronic phase. And like we said, this is the majority of the patients that we'll see that will attend the clinic, get it assessed, get it checked, either by the Total Foot and Ankle Clinic or your local podiatrist.